Kidney transplant giving patient a new lease of life. So when kidneys stop functioning permanently, dialysis is not the only option. A kidney transplant can offer a better quality of life. So let's understand what is kidney transplant. End-stage renal disease can result from diabetes, hypertension, or chronic kidney disorder. So when a healthy kidney from a donor is transplanted into a patient, it is called kidney transplant. Kidney transplant offers you better quality of life, greater freedom from the dialysis, and improve survival, and then there is no further restriction of your food or your liquids. So in India, we have mainly living kidney donor transplantation. Though deceased donor is an option, you can register for deceased donor if you don't have a living donor. So after transplantation, you need regular follow-up. You require regular immunosuppressive medicine so that your kidney do not get rejected, and you have to maintain healthy lifestyle. So a successful transplant can transform the lives and restore your independence.